Hey everyone, today we're diving deep into the world of sinuses. These small, air-filled spaces in your skull can cause big problems when they get blocked. You know that feeling, right? That pressure in your face, the stuffy nose, maybe even a headache that just won't quit. It's like your head is a pressure cooker, and someone forgot to release the valve. This discomfort can make it hard to focus, sleep, or even enjoy your favorite activities. Millions of people deal with blocked sinuses every year, and it's more than just an annoyance. It can really put a damper on your day-to-day life. From missing work to skipping social events, the impact is significant. But don't worry, in this video, we're going to break down exactly why sinuses get blocked and, more importantly, what you can do to find relief. We'll cover everything from common causes like allergies, infections, and even structural issues within the nasal passages. Understanding these causes is the first step to finding effective treatments. Speaking of treatments, we'll explore a variety of options from over-the-counter medications to home remedies and even surgical interventions for more severe cases. And don't forget about prevention. We'll share some tips and lifestyle changes that can help keep your sinuses clear and happy. So, if you're ready to breathe easy again, stick around. Alright, let's dive into the most common culprit behind blocked sinuses: infections. These can range from the common cold to more severe respiratory infections. You know the drill: you wake up with a scratchy throat, a runny nose, and that telltale feeling of pressure building in your face. It's a familiar scenario for many of us. Yep, you've probably got a cold. This viral infection is notorious for causing discomfort and disrupting our daily routines. Now, colds are caused by viruses, and these tiny troublemakers love to wreak havoc on your respiratory system, including your sinuses. They invade your body and multiply rapidly. See, your sinuses are lined with a mucous membrane that helps to trap dust, allergens, and other irritants. This membrane plays a crucial role in keeping your respiratory system clean. When you get a cold, this membrane gets inflamed and starts producing more mucus. This is your body's natural response to fight off the infection. Think of it like your body's way of flushing out the virus. Staying hydrated and using a humidifier can help ease the symptoms. But here's the catch: all that extra mucus can clog up your sinuses, leading to that blocked, uncomfortable feeling. This congestion can make it hard to breathe and cause headaches. And if that wasn't enough, a cold can sometimes pave the way for a bacterial infection, also known as sinusitis. This secondary infection can be more severe and require medical attention. Sinusitis is basically an inflammation of the sinuses, and it can cause even more mucus buildup, pressure, and pain. This condition can be quite debilitating if not treated properly. It's like your sinuses are saying, "Hey, we're trying to fight off this infection, give us a break." Using a hot compress can help alleviate some of the discomfort. And trust me, when your sinuses are talking, you definitely want to listen. Following your doctor's advice and using sinus rinses can help manage the symptoms. Now, most colds will clear up on their own within a week or two, but if you're dealing with a bacterial sinus infection, you might need a little extra help from your doctor. Rest and proper medication are key. They might prescribe antibiotics to knock out the bacteria and help you feel better faster. It's important to complete the full course of antibiotics as prescribed, but remember, antibiotics only work against bacteria, not viruses, so they won't be effective for a simple cold. Understanding the difference between bacterial and viral infections is crucial. The key here is to listen to your body, pay attention to your symptoms, and don't hesitate to reach out to your doctor if you're feeling under the weather. Early intervention can prevent complications and speed up recovery. Let's face it, allergies are the worst. They can make you feel absolutely miserable, turning your day into a constant battle against sneezing, itching, and congestion. They can turn even the most beautiful spring day into a sneezing, sniffling nightmare. The blooming flowers and fresh air that others enjoy become your worst enemies. And if you're prone to allergies, you know that your sinuses are often on the front lines of this battle. The discomfort can be relentless, affecting your daily activities and overall well-being. So, what exactly happens when you have an allergic reaction? Understanding this process can help you manage your symptoms more effectively. Well, it all starts with your immune system. This complex network of cells and proteins is designed to protect your body from harmful invaders. Your immune system is like your body's security guard, always on the lookout for harmful invaders like bacteria and viruses. It works tirelessly to keep you healthy, but sometimes it gets a little overzealous and mistakes harmless substances, like pollen or dust mites, for dangerous threats. This overreaction is what triggers your allergy symptoms. When this happens, your immune system goes into overdrive, releasing a chemical called histamine. Histamine is a key player in your body's defense mechanism, but it can also cause a lot of discomfort. Histamine is responsible for those classic allergy symptoms like sneezing, itching, and watery eyes. These symptoms are your body's way of trying to expel the perceived threat, but it can also wreak havoc on your sinuses. The inflammation and swelling can cause significant discomfort and make it hard to breathe. See, histamine causes the blood vessels in your sinuses to dilate, which leads to inflammation and swelling. This reaction is meant to help your body fight off invaders, but it can also cause congestion. This swelling can narrow the openings of your sinuses, making it difficult for mucus to drain properly. When mucus gets trapped, it creates a breeding ground for bacteria, leading to further complications. And you guessed it, that trapped mucus can lead to, you guessed it, blocked sinuses. This blockage can cause pressure and pain, making it hard to focus on anything else. Now, the good news is that there are plenty of things you can do to manage your allergies and give your sinuses a break. With the right approach, you can significantly reduce your symptoms. Over-the-counter antihistamines can help to block the effects of histamine, providing relief from sneezing, itching, and runny nose. They are a convenient and effective option for many people. While nasal corticosteroids can reduce inflammation in your nasal passages, these sprays are particularly effective for reducing congestion and improving airflow. For some people, allergy shots, also known as immunotherapy, can provide long-term relief by gradually desensitizing your immune system to specific allergens. This treatment can be life-changing for those with severe allergies. And of course, avoiding your triggers as much as possible is always a good idea. Simple steps like keeping windows closed during high pollen days can make a big difference. So, if you know that pollen makes you miserable, try to stay indoors on high pollen days, or wear a mask when you do have to go outside. These precautions can help you avoid unnecessary exposure. Your sinuses will thank you for it. Taking proactive steps to manage your allergies can lead to a significant improvement in your quality of life. Structural issues when your sinuses need a little help. Sometimes blocked sinuses aren't caused by infections or allergies, they're simply a matter of anatomy. This means that the physical structure of your nasal passages can play a significant role in how well your sinuses function. That's right, the structure of your sinuses can actually make you more prone to blockages. For instance, certain anatomical variations can create narrow passages that are more easily obstructed by mucus or swelling. One common structural issue is a deviated septum. The septum is the thin wall of cartilage that divides your nasal cavity in half. Ideally, it should run straight down the middle, but in many people it's slightly off-center. This is called a deviated septum, and it can obstruct airflow through your nasal passages, making it harder for mucus to drain properly. This obstruction can lead to a variety of symptoms, including nasal congestion, difficulty breathing, and even recurrent sinus infections. Now, a slightly deviated septum might not cause any noticeable problems, but a more severe deviation can lead to chronic congestion, difficulty breathing through your nose, and yes, even frequent sinus infections. In some cases, people may also experience nosebleeds or facial pain. Another structural culprit is nasal polyps. Nasal polyps are soft, painless growths that develop on the lining of your nasal passages or sinuses. They're kind of like small, benign tumors, and they can vary in size from a small grape to, in some cases, even larger. While the exact cause of nasal polyps is unknown, they're often associated with chronic inflammation, allergies, and asthma. These growths can obstruct airflow and mucus drainage, leading to congestion, facial pressure, and a decreased sense of smell. If you suspect that you might have a deviated septum or nasal polyps, it's important to see an ear, nose, and throat (ENT) specialist. They can examine your nasal passages and determine if surgery is necessary to correct the problem. In the case of a deviated septum, a septoplasty can be performed to straighten the septum and improve airflow. This surgical procedure involves repositioning the septum to the center of the nose, which can significantly enhance breathing and reduce symptoms. For nasal polyps, surgery can remove the polyps and widen the nasal passages, but keep in mind that polyps can sometimes recur. Post-surgery, patients may need to use nasal sprays or other medications to manage inflammation and prevent the return of polyps. It's also worth noting that maintaining good nasal hygiene can help manage symptoms and prevent complications. Regularly using saline nasal sprays or rinses can keep your nasal passages moist and clear of irritants. In summary, structural issues like a deviated septum and nasal polyps can significantly impact your sinus health. If you're experiencing chronic nasal congestion, difficulty breathing, or frequent sinus infections, it's crucial to seek medical advice. An ENT specialist can provide a thorough evaluation and recommend the best course of action to help you breathe easier and maintain clear sinuses. Don't hesitate to reach out to a healthcare professional if you have concerns about your nasal health. Environmental factors: the air we breathe. We often think about the air we breathe in terms of pollution, but did you know that even seemingly harmless environmental factors can contribute to blocked sinuses? For instance, everyday exposure to urban environments can introduce a variety of pollutants and allergens into our respiratory system. It's true, the air around us can play a significant role in our sinus health, and sometimes it's not for the better. Even a walk in the park can expose us to pollen and other allergens that can irritate our sinuses. One of the biggest culprits is dry air. Dry air can be particularly problematic in arid climates or during the winter months when indoor heating systems are in use. You see, our sinuses need a certain level of moisture to function properly. Without adequate humidity, the mucus that lines our nasal passages can become too thick and sticky. When the air is dry, whether it's due to cold weather, indoor heating, or low humidity, the mucus in our sinuses can thicken and become sticky. This can lead to discomfort and difficulty in breathing. This makes it harder for the mucus to flow freely and do its job of trapping irritants and draining away. Thickened mucus can also become a breeding ground for bacteria, increasing the risk of infections. As a result, we can experience that all too familiar feeling of congestion and pressure. This can be particularly bothersome during the night, affecting our sleep quality. But it's not just dry air that can cause problems. Other environmental factors like smoke and dust can also have a significant impact on our sinus health. Irritants like dust, smoke, and even strong perfumes can also irritate the lining of our nasal passages, leading to inflammation and increased mucus production. This can exacerbate existing sinus issues and make it harder to breathe. Think about it. When you encounter a strong smell, your nose crinkles up, and you might even feel a slight burning sensation. This is a natural defense mechanism of our body to protect our respiratory system. That's your body's way of telling you that something is irritating your nasal passages. Over time, repeated exposure to these irritants can lead to chronic inflammation and other long-term sinus issues. Over time, repeated exposure to these irritants can make us more susceptible to sinus infections and chronic sinus problems. This can significantly impact our quality of life, leading to frequent doctor visits and medication use. So, what can we do to protect our sinuses from these environmental factors? There are several proactive steps we can take to maintain a healthy sinus environment. Well, for starters, using a humidifier, especially during the winter months, can help add moisture to the air and prevent our sinuses from drying out. This can be particularly beneficial in bedrooms to ensure a good night's sleep. When it comes to irritants, it's all about minimizing exposure. Regular cleaning can help reduce the amount of dust and other allergens in your home. If you're sensitive to dust, make sure to dust and vacuum regularly, and consider using dust mite covers on your bedding. These covers can help reduce your exposure to dust mites, which are a common allergen. If you're a smoker, quitting is one of the best things you can do for your overall health, including your sinus health. Smoking can cause significant damage to your respiratory system and exacerbate sinus issues. And finally, be mindful of strong perfumes and cleaning products. These can contain chemicals that irritate your nasal passages. Opt for fragrance-free options whenever possible, or make sure to use them in well-ventilated areas. This can help reduce your exposure to potentially harmful chemicals and keep your sinuses clear and healthy. Lifestyle habits. Small changes, big impact. Believe it or not, some of our everyday habits can actually contribute to blocked sinuses. Simple actions like touching your face frequently can transfer bacteria and viruses to your nasal passages, increasing the risk of infections. It's easy to overlook these seemingly small things, but they can have a big impact on our sinus health in the long run. Reflecting on and adjusting our daily routines can make a significant difference. Let's start with one of the biggest culprits: smoking. The harmful chemicals in cigarettes not only damage your lungs but also irritate your nasal passages. We all know that smoking is bad for our lungs, but it's also incredibly damaging to our sinuses. The smoke can cause chronic inflammation and lead to persistent sinus issues. Cigarette smoke contains thousands of chemicals that irritate and inflame the lining of our nasal passages. This constant irritation can weaken the immune system, making it harder to fight off infections. This inflammation can lead to increased mucus production, making us more susceptible to infections and blockages. Over time, this can result in chronic sinusitis. But it's not just smoking itself that's problematic. Secondhand smoke can also cause significant harm to your sinuses. Even secondhand smoke can have a negative impact on our sinuses, especially in children who are still developing. Their smaller nasal passages are more easily irritated. Another common habit that can wreak havoc on our sinuses is dehydration. Staying hydrated is crucial for maintaining the thin mucus layer that protects our nasal passages. When we don't drink enough fluids, our bodies conserve water, and this includes the mucus in our sinuses. This can lead to thicker mucus that is harder to expel. As a result, the mucus can become thick and sticky, making it harder for it to drain properly. This can cause pressure and pain, often leading to sinus headaches. This can lead to congestion, pressure, and an increased risk of infections. Using nasal sprays can provide temporary relief, but they should be used cautiously. And believe it or not, even certain medications can contribute to sinus problems. Overuse of decongestants can lead to a rebound effect, worsening congestion over time. Some medications like decongestants can actually have a rebound effect if used for too long. It's important to follow the recommended usage guidelines to avoid this issue. While they might provide temporary relief, they can actually make congestion worse in the long run. This can create a cycle of dependency on the medication. So, what can we do to break these bad habits and give our sinuses a fighting chance? Making small, consistent changes can lead to significant improvements in sinus health. Well, if you're a smoker, quitting is the single best thing you can do for your health, both now and in the future. There are numerous resources and support systems available to help you quit. There are plenty of resources available to help you quit, so don't be afraid to ask for help. Apps, support groups, and healthcare professionals can provide the guidance you need. When it comes to hydration, make sure you're drinking plenty of water throughout the day. Proper hydration helps maintain the mucus layer that protects your nasal passages. A good rule of thumb is to aim for 8 glasses of water per day, but you might need more if you're physically active or live in a hot climate. Adjust your intake based on your activity level and environment. And finally, if you're concerned about the side effects of any medications you're taking, talk to your doctor. They can help you find alternatives or manage side effects effectively. They might be able to recommend an alternative medication or suggest ways to manage the side effects. Always consult with a healthcare provider before making changes to your medication regimen. Daily habits for healthy sinuses. Maintaining healthy sinuses isn't just about addressing issues as they arise. It's about incorporating daily habits and routines that support overall sinus health. These habits can help prevent sinus issues before they start, and ensure that your sinuses remain clear and functional. First and foremost, let's talk about nasal hygiene. Keeping your nasal passages clean can significantly reduce the risk of infections and blockages. Just like brushing your teeth, cleaning your nasal passages should be a regular part of your daily routine. This simple practice can help remove mucus and debris that accumulate throughout the day. Using a saline nasal spray or a neti pot can help keep your nasal passages moist and clear of irritants. These tools are easy to use and can be incorporated into your morning or evening routine. These tools work by flushing out mucus, allergens, and other debris, helping to reduce inflammation and prevent blockages. Regular use can make a noticeable difference in your sinus health. Next, consider the air quality in your home. Poor air quality can exacerbate sinus issues, so it's important to ensure that the air you breathe is clean. Investing in a good air purifier can make a significant difference, especially if you suffer from allergies. Air purifiers can remove a variety of airborne particles, including dust, pollen, and pet dander. Air purifiers can help remove dust, pollen, and other airborne particles that can irritate your sinuses. Regularly changing the filters in your air purifier ensures it operates efficiently. Additionally, using a humidifier, particularly during the dry winter months, can help maintain optimal humidity levels, preventing your nasal passages from drying out. Dry air can irritate your sinuses and lead to discomfort. Your diet also plays a crucial role in sinus health. Eating a balanced diet can support your immune system and reduce inflammation. Foods rich in antioxidants, like fruits and vegetables, can help reduce inflammation and boost your immune system. Incorporating a variety of colorful produce into your meals can provide essential nutrients. Spicy foods, such as hot peppers and horseradish, can also help thin mucus, making it easier to drain. These foods can provide immediate relief from congestion. On the flip side, Try to limit your intake of dairy products, as they can sometimes thicken mucus and contribute to congestion. If you notice increased mucus production after consuming dairy, consider reducing your intake. Exercise is another important factor. Regular physical activity can improve your overall health and support sinus function. Regular physical activity helps improve circulation and can promote mucus drainage. Exercise can also boost your immune system, making you less susceptible to infections. Even simple activities like walking or yoga can make a big difference. These low-impact exercises can be easily incorporated into your daily routine. Just be mindful of the environment you're exercising in. For example, avoid outdoor activities when pollen counts are high if you're prone to allergies. Checking the air quality before heading outside can help you avoid potential irritants. Lastly, manage your stress levels. Chronic stress can have a negative impact on your overall health, including your sinus health. Chronic stress can weaken your immune system, making you more susceptible to infections. Finding ways to manage stress can improve your overall well-being. Incorporate stress-relieving practices into your daily routine, such as meditation, deep breathing exercises, or even just taking time to relax and unwind. These practices can help you maintain a balanced and healthy lifestyle. By integrating these habits into your daily routine, you can create a solid foundation for healthy sinuses. Consistency is key to maintaining sinus health. Remember, small changes can lead to big improvements over time. Start with 1 or 2 new habits and gradually build from there. So, take a proactive approach to your sinus health and breathe easier every day. With these daily habits, you can enjoy clearer sinuses and better overall health. Breathe easy again. So, there you have it, folks. We've journeyed through the intricate world of sinuses, understanding their function and the common issues that can arise. We've covered a lot of ground today, from the common cold to the surprising ways our environment and even our daily habits can impact our sinuses. It's fascinating how something as simple as the air we breathe can have such a profound effect. Blocked sinuses can be a real pain, literally, causing discomfort and affecting our daily lives. The pressure and congestion can make even the simplest tasks feel overwhelming. But the good news is that armed with the right knowledge, you can take charge of your sinus health. Remember, prevention is key. Educating yourself about the triggers and symptoms can make a significant difference. By making simple lifestyle changes like quitting smoking, staying hydrated, and maintaining a balanced diet, you can support your sinus health effectively. And minimizing exposure to irritants such as pollution and allergens can further protect your sinuses from becoming inflamed or blocked. You can significantly reduce your risk of experiencing those dreaded blocked sinuses by incorporating regular exercise and stress management techniques into your routine. And if you do find yourself battling a sinus infection or struggling with chronic sinus issues, it's important to seek professional help. Early intervention can prevent complications. Don't hesitate to reach out to your doctor. They can provide personalized advice and treatment options tailored to your specific needs. They can help you determine the underlying cause of your symptoms, whether it's an infection, allergies, or another issue, and guide you towards effective relief. And recommend the best course of treatment for you, ensuring you can breathe easy again and enjoy a better quality of life.